So you just heard one woman's story who, like many others, put off getting their mammogram, which is why we have Christine Brannick, Oncology Outreach Manager with Cone Health Cancer Center, here to talk about early detection. All right, so let's talk about this. Missing your mammogram can impact you in many, many ways.
It's very important we get our mammograms that they are recommended, because mammograms can detect breast cancer before we'd ever feel them or before there's any signs or symptoms. The American Cancer Society estimates that over 350,000 women will be diagnosed with breast cancer this year, and 43,700 will die. And it's very interesting because I've been in this role for 22 years, and when I started here, it was 188,000 women were being diagnosed, and 44,000 were dying from breast cancer. So that just shows how far we have came with diagnosing breast cancer early. And there is more than 4 million breast cancer survivors in the United States alone.
Yeah, we like to hear those survivor stories as well, for sure. You've been, at the Oncology Center for a long time. So how have you seen missing a year or two impact the cancer rates?
If missing mammograms can decrease, as far as the diagnosis, delay diagnosis, meaning that it can decrease the chance of survival. If we find breast cancers earlier, there's many more treatment options. And so it's very important that we find them early.
Okay, and so let's kind of go over what the guidelines are, the recommended ages for women to start getting screened and to have their mammogram.
The women should begin getting screened for mammograms at age 40. For those women who have a strong family history or have done genetic testing and are positive for the BRCA mutation or one of the other genetic mutations, it's important to have a conversation with your doctor to determine when you should begin your mammograms.
Okay, so age 40 is when it starts, and then how often? Is it every year, every other year? What do we need to know? What is our routine guideline?
Mammograms are recommended every year beginning at age 40.
Okay, every year at age 40. All right, we're going to continue to talk about breast cancer and talk about mammograms and how we can, be on the good side of those stats. We're coming back in just a few moments.